Hi, my name is Ashley Morgan, and I'm going to do a presentation on death, dying, and bereavement. In this presentation, I will talk about the following: experience of death, process of dying, experience of grieving. Chapter 17. Death. When you hear the word death, you think, yep, somebody died. But really, there are 3 stages to death, or 3 categories. I'm going to discuss 3 of them in this presentation: clinical death, brain death, social death. Clinical death. Process as well as a state. Considered a few minutes after the heart stops pumping, breathing has stopped, and no signs of brain function. But do remember, at the same time, resuscitation is also still a possibility in some cases. When it comes to resuscitation, most of the time, it's in heart attack patients. Brought back from clinical death, also those who state they were close to death experience were in the state of clinical death. The definition of clinical death: a period during which vital signs are absent, but resuscitation is still possible. Brain death. State in which the person no longer has reflexes or any response to vigorous external stimuli, and no signals in the brain. The brainstem is not affected. The person usually can still breathe on his own then. If the brainstem is affected, the person may still be able to breathe on their own, but may have to have life support to breathe, but will be left in a vegetative state. When someone that ends up having the brainstem affected and is left in a vegetative state, the person is considered legally dead. Sad. Brain death has been known to occur due to the brain injuries such as a car accident. Other body organs can still function, be maintained artificially. In that case, the heart, kidney can be used for organ donation as long as removed in a timely manner. Definition of brain death: the point at which the vital signs including brain activity are absent and resuscitation is no longer possible. Social death. The family of people treat the deceased person like a corpse. Someone may close their eyes or sign a death certificate. Once social death has been acknowledged, the family and friends have to begin to deal with the loss and accept it. The definition of social death: the point at which family members and medical personnel treat the deceased person as a corpse. Where death occurs? Death can occur anywhere, technically. The reason I say that, such as accidents, you hear people say dead on arrival. But most generally, deaths occur in hospitals, hospice facilities, at home with family, and sometimes with the help of hospice care, or at nursing homes. Hospice care. The definition of hospice care: an approach to care for the terminally ill that emphasizes individual and family control of the process of dying. Aspects of loved ones dying or dead. It's normal, usually. I mean, in some cases, we may have a fatal accident that may kill our loved one. Not so normal. But most generally, it's normal. Need to accept. Accept the fact that your loved one is gone or dying. Do not avoid it. Face the facts and remember the good times and accept that it was their time to go. Families need to be involved with their loved ones as much as physically possible. You ask why? The reason why is to help each family member to come to a resolution of his or her relationship with the dying person and be there emotional support for the dying loved one. Have control over the care your loved one gets. It should always be in the hands of the patient and the family what type of care the patient gets. You decide the treatments and whether to accept them or deny them. Whether or not your loved one remains home or hospitalized or put in a nursing home or hospice facility. Be in control. Remember, when your loved one is dying, we should have the medical care that should be palliative care rather than curative treatment, meaning that the patient care is on controlling pain and maximizing comfort. Palliative care definition is a form of care for terminally ill people that focuses on relieving patients' pain rather than curing their disease. Process of dying. Those who are dying usually go through a series of stages. Denial. No way, not me. I can't have that. There's no way. You go to the doctor, find out you have cancer. You're in denial of it, so you ask for another opinion. There's no way it's me. Anger. When you realize it's true, that you do have the diagnosis and only have a short period of time to live, you think, why me? Why? You get really upset and emotional and think, what have I done? Bargaining. Maybe if I take my medicine, I'll live longer. Maybe if I pray to God, He'll heal me. Maybe. You think of all these possibilities that you can cure yourself instead of facing the facts. Depression. One may go into depression. Why be compliant with taking my medicine? Or be compliant with the medical personnel's or their advice. I'm dying, right? You face the fact, but now you're taking it hard on yourself. Depression. Acceptance. You finally accept the fact that you may have a short life to live, but accepting the conditions and that death is approaching provides you with an easier pathway as you are dying. Experience of grieving. Wakes, funerals, and death rituals. Wakes helped loved ones mourn and remember the good times and express their emotions and pay their respect to their loved one. Funerals, which are most generally right after a wake, are a time where loved ones lie their loved ones at rest and say their last goodbyes for now, but not forever. Death rituals. Different cultures have different death rituals, which is something I did not know until now. One example I'm going to give you is Jewish spend 7 days, the whole family in one house, to mourn and talk openly about the emotions and to get to the acceptance part of the loved one being deceased. Process of grieving. Everybody goes through a different process of grieving. Some people accept death well. Other people do not. But mainly the process of grieving for those who have really accepted, they mourn over it. They may be sad for a little while, but then they accept it. Sometimes the process of grieving for those who have a hard time accepting it, they mourn over it and they keep mourning over it. They never get to the accept it part. They talk openly about it, or they may avoid it. Don't even talk openly about it. When they don't talk openly about it, that's where they can't get to this acceptance part. By talking openly about it helps the process of grieving. Some people need to join in a support group to be able to accept the fact that their loved one's gone. Some just need to learn to talk openly about it with their family and friends. And last but not least, don't ever avoid it. If you avoid it, it could lead to many different things. Depression, suicide. There's always support groups out there for those who need help in grieving. Here's my works cited page, and thank you for watching.